So thanks to both of you for joining us today, and we would love to make this an informal conversation between the two of you and really talk about the major trends in healthcare. Ever since the word healthcare reform sort of hit our country many years ago now, lots and lots of talk about innovation. Innovation by insurance companies. I think you heard from Brad Wilson this morning. Innovation in terms of convenience and how we provide care to patients, innovation in technology, in pharma, all kinds of innovation, and a lot of it focused on meeting the consumer where the consumer is, as opposed to meeting the providers where the providers are. And I know it's your 10th day on the job, so you can either talk to us about all the things you're doing at Carolina's healthcare system, or you can give us some insights into some things you've done at Christus and some plans you might have for Carolina's healthcare system. But the first question really is, how do you view this major trend around consumers and a changing consumer, and what are your healthcare systems doing or planning to do to relate to consumers in a different way?
Let me go first. Well, first of all, when you look at our patients across Charlotte or all of our markets, they are very savvy consumers of healthcare. So let's make sure we understand that. And one of the things that we're seeing, we interviewed our patients across 4 states, probably thousands of them, to help us define what a remarkable patient experience would be through their eyes. And what we're finding is access and convenience is absolutely one of the first things that they want. In addition to that, they want healthcare to be affordable. So when you think about those 3 topics, some of the things that we're doing at Novant Health is truly working with our providers to change the way we deliver healthcare. So for example, e-visits, video visits, web-based scheduling, our clinics, for example, a lot of our existing primary care clinics, we're looking at bringing 2 and 3 shifts of people. So instead of operating between 9 and 5, those clinics have extended hours to meet the needs of consumers and keeping the price point at a primary care price point for people. And so these extended hours clinics, express care clinics are really becoming important for us. Last but not least, when I think about all that we're doing, patients are loving the technology, the access to care, and the ability to have that convenience right at their fingertips, and the affordability of being able to do that.
So let me start off by reminding everybody this is day 10, okay? So I've only met 5,000 of the 60,000 associates we have. So I might ask for a lifeline. I see some of my colleagues out there if I don't quite get all the facts right. I would agree with Carl. I was thinking 10 years ago is when that first iPhone came out, and now here on stage I can order, I can reserve restaurant, I can schedule transportation and have flowers for my wife by the time I get to dinner. And that's changing the nature of consumerism in terms of how it affects healthcare, I think is the point that you made. And I have, my oldest is a millennial, so those of us that know how millennials communicate, it's only by text. So patient-centered care for millennials are going to be fundamentally different than it was for us growing up. That said, I think it's a misnomer to think that the 50 and over crowd is not also technologically savvy. I mean, most of us do either shopping or banking online. So whoever ignores this consumerism trends, I think, does so at their own economic peril going forward. As I'm learning about Carolina's healthcare system, again, day 10, I know that we do a couple of things. Last year, we had several thousand virtual visits. I think 2/3 of those were actually on the mobile phone, and 1/4 of those actually substituted for actually a primary care visit. So that's one aspect. We all have Fitbits and things of that nature. I think we have now Carolina's Tracker, which you have 70 different devices we can integrate for our associates or for patients that can kind of help them manage their health. So these are a couple of examples, and I think you mentioned the convenience of care. Well, we're big on on-demand care. And so I think as you look, we have, I believe, 25 different urgent care centers. And so we're like open table for restaurants. We're rolling out so that you can actually reserve your place in line for urgent care on demand. So these are the same things that we're looking at Carolina's healthcare system.
Great. So trend number 1, the consumer. And I think how healthcare systems respond to the consumer will really differentiate them over time. Trend number 2, and this is one that is affecting all parts of the healthcare system, insurance companies, providers, suppliers, all parts, including patients, is all of the innovation around payment reform. So I don't know how many of you know and see all the acronyms we have in healthcare. We have ACOs, we have bundled payment, we have the MACRA law. All of these are, we think, attempts to change the way that healthcare is paid for and change the way that healthcare is delivered. And so bundled payment means you group aspects of care together and you have a bundled price for a procedure, let's say, or a high-cost acute care condition or a chronic condition. And that causes the pieces and parts of the healthcare system to have to work together to figure out what's the best way to deliver the care and what's the best way to manage the cost of the care. So I'd love to hear from both of you, and we'll start with you maybe, Jean, this time. Where do you think bundled payment applies best? And how do you think these ACOs and these population health models are really going to play out in this marketplace? And then maybe what are you two doing in your own organizations around that?
Well, I think the bundle payment concept is a little bit tied to the consumer concept in some ways. My father-in-law recently had a broken leg, and I'm the son-in-law that can navigate the healthcare system, so I'm the one that they call all the time. And it can be complex, and they're trying to figure out, well, this provider had a bill here and this provider here. So the concept of having one bill for all of the care, I think, is directionally correct. I think part of the challenge, and Medicare has 48 different bundles and they're trying to create predictability for 70% of their spend. So I think that's a good thing to try to work through that. The Kaiser Foundation just came out with a study on bundled payments that said, the verdict is still out. In terms of costs, sometimes the savings you see in the inpatient care area, but that in the post-acute care, then kind of offset, and they're too high in that segment. So, and then quality, I think it's evolving. There's some good news around that. And so I think both of our organizations, I believe, are participating in bundled care. We're one of the communities that are participating mandatorily in a joint bundle, hips and knees. And I think that'll continue to be part of the experiment that we all learn from. So I think directionally these programs are correct. I think the challenge is healthcare is complex, and so the verdict will be out, I think, for some years ahead.
Yes, so at Novant Health, and I agree with Jean, we actually have 27 bundles right now with different payers, hips, knees, pneumonia, just to give you some examples. It's about 2% of our revenue, but 2% sounds like a small amount, but that's over $90 million. So when you think about that, let me give you the idea of, we're talking about 3,000 cases a year for us at Novant Health. What that means, though, for us, when I look, it's not only the care that we provide, but like Jean said, it's the post-acute care. So what we're doing and what I'm excited about is we've actually lined up 40 different skilled nursing facilities and 40 different home health agencies that cover our 4 states that help us with obviously stepping up that post-acute care to keep costs down, to obviously increase quality, and last but not least, but to prevent readmission. So it's that kind of work that I'm really excited about in the early stages, but we still have a lot of work to do.
So how do you think these new payment arrangements change the relationships with physicians or providers? So when you think about bundled payment or you think about ACOs, are your relationships with physicians changing? This new MACRA law, which was a bipartisan law that fundamentally moves all providers, physicians, into a payment system that is tied to quality and safety and assuming risk for patient populations over time. How is that changing your physician relationships?
I'll start. So we have 1,700 physicians that and providers that are in our medical group, the Novant Health Medical Group. But there's 5,000 physicians on the medical staff. So we're talking about partnering and integrating with all 5,000, not just the ones that decided to take employment relationships with us. So we're creating clinically integrated networks for a lot of the independents to work with us on the same protocols, align those incentives across both those physicians in the medical group and those that are independent. What I'm most proud of, though, is we at Novant created something called the Administrative Physician Partnership. And it's been really something that puts physicians at having their voice at every table inside of our organization. In every market, every location, it's structurally set up exactly the same, where physicians can truly communicate with physicians, not only the independent doctors, but those that actually we're very dependent on to have the success of the ACO performance and the bundled payment performance. They're integrated into the strategy to ensure it's successful.
So this is where I claim 10 days on the job in terms of all the things we're doing. I will say this, and we just use a term called MACRA. And we like acronyms in healthcare. That's sort of redesigning the way that physicians are paid. I think it's 690 pages or something along those lines, and Medicare contradicts itself often in that document. Again, I think the attempt is right, though. It's trying to align how hospitals have been getting paid for a while, which is paid for performance, with how physicians get paid, which is paid for performance. So we're making that journey. I think that will get better over the next 5-6 years. And I had the opportunity with Dr. Roger Ray to attend a leadership meeting last week of 40 of our top leaders throughout the system. And it was a wonderful discussion about how we align payments, how we align delivery. So the short answer is I think these payment evolutions are aligning us closer with physicians. We have CINs and bring in leadership, as Carl alluded to, much more into the C-suite, if you will.
Yeah, and as it relates to all this measurement and the transparency and even public reporting of quality and safety scores, we have U.S. News and World Report, we have Leapfrog reporting, we have now what's called a hospital star rating system that's been delayed but will ultimately be rolled out. Tell us a little bit about how you view transparency of your results, and how do you think consumers can really digest it? How will it help us change the quality, safety, and cost of healthcare in this country?
So there's an article that came out, I think 3 or 4 years ago, that you may have seen too, which is a report card on those who generate report cards. And the title was, "Are you confused yet?" And so I think what you'll hear us say is that we are very for transparency. The question is, some of these companies have black box methodologies. They're not transparent, so you don't know what the criteria is. That's really fundamentally trying to give information to the consumer about deciding, is this system better clinically than this system? So I think there's a lot of work still to be done with that. On the AHA board that I serve on, we're talking to Medicare about their star rating, which you mentioned, which is there's some socioeconomic factors that need to come into play in that as well going forward. So I think it needs to evolve. What I'm excited about in this leadership meeting that I referenced last week with physician leaders, we're actually putting our quality on the equivalent of Yelp. So if you go to a physician's office and you want to rate that physician, and that's going to give us some really direct feedback from our patients that we can in real time adjust to. So again, it's evolving, directionally correct. We support transparency, but we're also playing a role ourselves in making sure we're hearing directly from our patients.
Well, and I agree. I think it can be really confusing. For us, it's confusing. So you can imagine for people trying to read the surveys and understand what is it really saying. And don't forget, the surveys sometimes, they're such a lagging indicator. I mean, they're 12 to 18 months behind of what really is happening in certain facilities or certain systems. So part of what we've tried to do is just stake a claim that we want to be in the top decile performance on quality and safety. That's our goal. And then what we do is we actually take both publicly reported data and non-publicly reported data and put it on our website so people can clearly see it and articulate it. So for example, infection rates, things like that, where people can see, and how do we stack up against the national average, and what's out there against, what is the top decile performance look like? And so we do that for our physicians and for our system as a whole, and hopefully that's where people can go to get current information. Just like Gene said, they can go and look at Yelp and other things. Go to our websites and see the most current data, because we're trying to put it out there so you don't have to search for it.
Okay, so switching gears now to pharmaceuticals, and we may even have some pharmaceutical companies
Raise your hand if
in
you're
the
pharma.
audience.
Okay.
You know, there are some that would call this a pharma crisis, and we've all watched the Valiant CEO and Touring Pharmaceuticals, and we've been reading about drug shortages, we've been reading about the high cost of pharmaceuticals. We've been reading about some very significant increases in pharmaceutical pricing. When we talk to our CEOs across the 3,600 hospitals that are premier, they would say pharma cost management and pharma adherence, especially for high-cost chronic patients, is a top 1, 2, or 3 challenge for their healthcare systems going forward. So my question is, how is that manifesting itself in your systems? And do you think there's a provider-driven set of solutions for this? I mean, what can we do to help solve this problem?
Yeah, I'll start on this one. So I want you to think about the specialty drugs that we're talking about. They might be 1% of our total prescriptions, yet they're about 32% of the total costs. So think about that. The other things, when you think about even brand name pharmaceuticals, and you look at how they've increased since like 2008, we've seen about 127% increase in that, and then also an 11% increase that's been passed on to consumers. So again, it's a serious problem. We've got to figure it out. Part of what I would want to do is start to have a conversation, not only with healthcare providers, but and Susan, we would need you to help us with this, but pharmaceuticals and companies and others to help us figure out what is really a breakthrough pharmaceutical. Because you heard this morning, not all pharmaceuticals or prescriptions are going to work for every patient. So is it really a breakthrough, and does it deserve a breakthrough price? And that's a conversation that we got to bring consumers in too to help us with that. You know, is a week of an additional cancer patient's life, that's a tough conversation to have. But we need to understand that, because some consumers may feel like that might not be breakthrough, and so we ought to define that. The other thing I would highlight is that health systems have to take a little bit of the responsibility for the increase in pricing. I mean, some of this where we've converted freestanding locations to hospital-based, I mean, that's part of what we do. So part of what we now have to figure out as we transition from fee-for-service to value is how do we look at our utilization? You saw how much money we're spending in healthcare. How do we reduce our utilization and maybe apply that to some of these drug costs that are absolutely needed? And I think we're spending enough in healthcare, and how do you share that to make sure that people are getting the right pharmaceuticals at the right time and at the right price?
And I would agree with just about everything he said. If you step back, I think Americans spent $375 billion last year on prescription drugs. If you look at Medicare, it spent about $145 billion in 2014. So let's look at the cost equation. So that spend from Medicare on prescription drugs increased 15%, 2014 over 2013. If you look at hospitals, if you look at the producer price index over that same period of time, we actually decelerated, I think, by 1.4%. So I agree with Carl. We all own the affordability, but it gives you a sense for how the pharmaceuticals are driving the cost of care. There's a number of things that we can do, I think, but I think also looking at pharma, and again, we all own affordability, the top 9 out of 10 top pharma companies spent more on sales and marketing than they did on R&D. Okay, so one particular company, we won't name specifically, but spent $17 billion on marketing and $8 billion in R&D. So that equation is out of whack. So we got to figure that piece out. The other part of it, let's go back to the FDA, because part of the challenge is shortages. I think if you look at the top 2,000 drugs over the last decade, there's been shortages all along, including on some basics like epinephrine when you come into an emergency room with a heart attack. So it can be a pretty scary thing. So we've got to go back to the FDA and a number of things. One is speed up the approval process is one. But also I think we have to be mindful of some of pharma's activities with respect to once they have a patent on a drug, sometimes they change that drug a little bit so they can extend their patent, and that prevents generics from coming in. So it's a complex equation. It is driving, just like Carl said, it is driving the cost of care, and we have to all embrace a solution, including right care at the right place at the right time. But it is something that I think it has the industry's attention and actually has a lot on the Hill right now, thinking about how do we stem that cost curve going forward.
Yeah, so speaking of the Hill, and this was not a prepared question, so I don't know how they're going to answer this. They haven't had time to think about it. We are in the midst of a crazy presidential election. And I'd just love to hear from both of you your thoughts about how either outcome affects your healthcare system, or how you might be preparing for either outcome in a presidential election, or if it just doesn't really affect you.
Yeah, I think that's the interesting point. But when I look back at when the Affordable Care Act came out, I remember there were so many people digging in, even in the hospital care, in the health systems. I'd go to meetings and CEOs were digging in whether they were going to support it or whether they weren't. And I'll tell you what we did at Novant. We simply said, our job is to work to help have everybody access insurance and affordable health care. So part of what we did is started focusing on our own cost, and then how do you pass those savings on to people? So what I would tell you, Susan and others, is that, regardless of the election, we are going to try to figure out how to make healthcare more convenient for people, easy to access, and affordable. So for example, the way these savings that we've generated, we've actually reduced costs in Novant Health over the last 5 years by about $450 million. And then we started passing those savings on to our communities. So changing some of our hospital-based imaging centers to freestanding, truly opening up primary care offices late with new price points, bringing these express care clinics in, these e-visits, video visits that are a lot cheaper than even a primary care visit. So my point is it's our job to help make healthcare affordable and easy to access, and I know Gene and I can work to do that together.
Great. I agree. Part of the thinking is, depending on who gets in the White House, so if it's the presumed Republican candidate, there's some thinking that healthcare policy will be driven really by the Hill and Paul Ryan, who has written and has a lot to say in the past around that. So that there are some fundamental changes there potentially. If the presumably Democratic candidate gets in, it looks like healthcare will be run more from the White House potentially than the Hill, and obviously that candidate had a lot to do with sort of some of the foundations of HCA. So I think we're trying to figure out what's the go left, go right, and we won't know for a little while. But what Carl said is, I think, is the important piece, is that fundamentally, no matter what happens, if you're providing good quality care, if you're providing a good patient experience, if you're providing good access, no matter what those payment systems are, you'll do very well in the future. So our focus is focus on the patient. But we have to be mindful, because some of these alternative payments models can have some unintended consequences. So we just always have to be attuned to that.
Good. Let's switch gears now to employment trends. Bob Morgan last night at our dinner said that healthcare is the largest employer in this area. I think he said 90,000 jobs. It's a lot of jobs. Just love to hear what you think the trends are, where you think growth is occurring in employment and healthcare in our communities across the state, and what you see in terms of the employment trends.
Yeah, well, I think that some projections are that healthcare jobs are going to increase about 20% over the next 5-7 years. So that's continuing. Part of the challenge and the concern is we have about 1 million nurses that over the next decade will be retiring and will be leaving the workforce. So that's a real concern, because as people get sicker in the hospitals, we need to have a competent workforce to take care of them. One of the things I'm learning about Carolina's healthcare system, which is very exciting, is the Center for Advanced Practice. So working really with nurse practitioners, PAs, physician assistants, to really let them practice at the top of their license. Sometimes these caregivers are doing things that other folks can be doing better. So I know that we've done some great work. I think one of the largest training programs in the country. So we're really trying to figure out how do we build different sort of capabilities and competencies into our workforce.
Yeah, we continue to see the need for, of course, physicians, nurses, and advanced practitioners. I think we've already hired 600 advanced practitioners inside of Novant Health to help us And like Gene said, we've got to make sure everyone's practicing at the top of their license. I mean, to make sure that that's occurring. The one thing I really am concerned about, though, is when you look at the shortage of individuals that are applying for those careers. We're starting to see a decrease in those that are applying to be physicians and nurses and advanced practitioners. So that's going to be something that's concerning. The other thing is those that actually get into medical school or nursing school and then get out, they come out with an education debt that sometimes is just, astronomical when you think about that. So another concern is in the new model that we're going to be in as we move to value, are we going to be in a position, how do we make sure they can pay those salaries and that debt back? I mean, that's the thing that we've got to think through. So I think part of what we might have to also do is challenge our education system to help us figure out how are we going to train folks a little more efficiently and effectively. And then last point I'd make is that we at Novant Health actually started something called Leadership Novant, which actually is preparing even the next level of workforce. So once you get physicians, nurses, and advanced practitioners practicing at the top of their license, we need to also train people that can help them, and maybe that there's a whole level of new careers that are coming up to help us with population health, data analytics, and all of those things that not yet have been effectively trained in the health system yet.
And the only thing I would add to that is, part of the challenge also, our clinicians, our physicians and nurses are going through some pretty significant burnout. And I think we're trying to make sure that we're acknowledging that as well. It's if you look at just the computer systems that we have to put in the facilities, a lot of them are not necessarily about patient care. They're about all these regulatory pieces that we need to make sure we check the boxes for. And it's pretty frustrating to a lot of the physicians. We have and nurses as well, and clinicians. We have an upgrade coming up here soon, so it's really top of mind for me. But I was thinking, how many of you were Lotus 1, 2, 3 folks? You're going to show your age. Okay, all right.
You're really showing your age,
really
Gene.
showing, and so I just remember for me going from Lotus 1, 2, 3, where I knew how to do macros and all that, to Excel, and that was a big change for me. And I think back, it's pretty much the same spreadsheet, if you will. If I think of that, then the equivalent of physicians and nurses and other caregivers who have a patient at the other side, all of these changes that we have to accommodate in our information system, I think is adding to the burnout. So I think we need to figure out how to also, with the new generation and the new workforce, do better by them in terms of making it easier.
Yeah, Gene, I want to add to that because I think you're hitting on a point that we saw a couple years ago. And part of what we did is we actually launched something, an intentional leadership for physicians and nurses. And so far, about 600 of our physicians have gone through the training. And I'll tell you how I know it's working. I've gotten letters from their spouses that have talked about the people they originally married, why they went into medicine, why they're so excited about getting back into the clinic or the operating room. So it's really investing in our people. So the one thing I think we both can do is make sure that we're caring for our people with world-class, making them world-class people so that they can truly deliver world-class care to the patients we serve. So I think that's something we need to do throughout the market.
Well, and you both touched on technology and the need for technology, but the uses of it. And one of the challenges in the industry is the technology still can't be connected in the ways that it needs to be connected to actually take care of patients across the continuum or take care of a population and have all the information. Interested in what you're doing or what you're planning as it relates to continuing investments in information technology to really get the business intelligence that you need and get it in the hands of the providers. And then there's so much written today about cybersecurity. Interested in your thoughts around the kinds of investments and things you need to be making to make sure the information is protected.
So we've invested, of course, significantly in a single electronic health record. Many of you may know it as MyChart when you're out there, because you can, of course, access your medical records and schedule appointments. What I will tell you, it's changed the way, again, that providers have delivered care. I think part of what we've got to do next, though, is we've got to figure out how to connect each other, because our patients go from one system to the other. Because the only complaint I ever hear, if a patient is in the Novant Health system, we're perfectly connected. But obviously, people travel, people go places, they see other specialists, they see things. We've got to make sure that we're connected so people don't have to worry about, do we understand their medical record? Do we understand the information that they have and what's going on? With regard to cybersecurity, I would tell you that obviously we're really concerned about what we're seeing across the industry. And you may not have heard, or you may have heard, but this ransomware attack that's going on in hospitals right now, where they're locking up computer systems that have patient records in them and asking for ransom, and certain hospitals have had to pay it. Now, I will tell you, so part of what we're doing is we've done a deep dive on ourselves. We've had people attack us. We're looking at ways to do it. I'm concerned, though, that even as much as we invest and continue to invest in stepping it up to protect everything from cybersecurity, they continue to attack. So I think it's going to be all of us working together to ensure that we've got the solutions to protect each and every person's record like they deserve to be.
And I would echo that. The part, and we have tools that we operate from the premise, the more that a patient knows about themselves and the more that the caregiver knows about that patient, then the better care we can provide. So we have that equivalent of OneNote. So you can go back, some of us did blood work 3 months ago and are trying to forget, we were forgetting, where we're at and what are the physician's notes? What are the physicians saying about your care? And we have now access to be able to do that. On the digital side of it, I think it ties a couple of themes together because we go back to the consumerism. It's sort of like, what does healthcare look through Amazon's eyes, right? Because if all of us go to Amazon, we order something, and then they have 5 other choices that you might pick from. I think we're needing to evolve to that kind of thing, and I'm thinking sort of Miss Jones. She's 60 years old. She schedules an appointment online. But if we know that she needs transportation, why can't we also connect it at that same point in time? If we know that she's going to run out of meds in 3 days, why can't we then have somebody pick them up, that person that's picking up, deliver that medication? So we really need to rethink that. We are investing in those technologies. We know that some of those technologies won't have legs going forward, but some will. So we're in a pilot mode, I think. But I do think that where the future is going is that predictive capabilities as well, which is, I think right now we take 40 variables if you're in the hospital, and we can predict with 80% certainty whether you're going to come back in the hospital. So that's knowing about the patients we serve, and then we can attach caregivers and social workers and care managers around that. So I think that's really, as Carl said, that's where the industry is going forward, and it's really all to the benefit of the patient.
Another example is for example, now that we have, of course, our electronic health record across the whole footprint, we have 97,000 diabetics in the database. And through these predictive analysis, we can determine without being seen which ones are going to show up in the emergency room. So it kind of gives you what we can intervene on and how we can reduce costs by helping people make sure that really doesn't occur.
So as it relates to taking care of people from a wellness perspective, keeping them out of the hospital, and taking care of your own teammates and the people that work in your healthcare systems, as you know, in Charlotte, we have this Healthy Charlotte initiative that you both sponsor along with us and others. Tell us a little bit about what you're doing inside your healthcare systems to advance the health of the community, the health of your employees, the wellness of the community. Just interested in some of those trends and ideas.
So we have a Carolinas healthcare system. We have Live Well, and so we connect with our stress management. We have health coaches. We have weight management programs. I'm told that we have 10,000 associates, teammates that participated in the weight management and lost 18 tons of weight. So that's a big number, and it's great health for them. And we have some incentives for them to do that in their health savings account. So I think it's really important for us to keep a healthy workforce. We talked about the workforce shortages and all of that. But also, as we're talking to employers out there in the community, they're asking us, well, how are you taking care of your own 60,000 associates? And so we're really have a lot of great data now that we're assembling to say we can take care of our associates, and we certainly can take care of your teammates as well, both from bending the cost curve, but also from making sure that they're healthier.
So we basically have close to 25,000 team members, and I can tell you we have, the first thing we did was actually we created walking trails around our facilities, which has been pretty exciting to watch them during lunch, before work, after work. In addition to that, we've been working with the American Heart Association. I saw some folks from the American Heart Association that are here, and we changed our vending and our snacking throughout our facilities to offer healthy choices. So if you think about all of the meetings that we have, there's no more soda. There's actually water and healthy snacks. I mean, so that's just those examples. And then last but not least, I just talked about this burnout that we're seeing in physicians and nurses, and this intentional leadership program for them to keep them well and healthy and excited about the professions they went into is how we're really going after to keep our people well. And I'll go back to, if we can be world-class at keeping our people healthy, they can be world-class at keeping our patients healthy.
One of the trends getting a lot of publicity, and rightly so, is what we as a country are doing or not doing about mental health, behavioral health, addiction, suicide rates, opioid. Interested in how you see that in your healthcare systems. It's a huge determinant of cost and a huge determinant of outcome. So just interested in your activities around this trend of solving the mental health care issues and behavioral health care issues.
And I would just say that I think 1 out of 5 Americans right now are dealing with that, and it really is time to get it from the back burner out to this conversation. So I'm glad we're acknowledging it, and part of it is dealing with the stigma, because dealing with behavioral health should be no different than struggling with diabetes, and we're still as a society wrestling with that. I will say unequivocally that one of the things that really attracted me to Carolina's healthcare system is sitting at an AHA meeting, American Hospital Association meeting, and finding out that Carolina's healthcare system is known nationally for its models of care. I think we've done last year 10,000 virtual visits, my son, I shared with the team last week, had somebody very close to him deal with behavioral health, and it can be quite personal. We have 2 hospitals, inpatients, but really it's this outpatient care that I think we are really focused on as well. And that's one of the ways to serve the community. No systems are having a profit off serving behavioral health. It's just the right thing to do for the communities. And so I am very committed to that. I'm looking forward. I think in 2 weeks from now, we'll be touring and visiting our caregivers that are doing great work in that space.
So I'll just give you a feel for, I round a lot, and I kind of just show up in a lot of our facilities unannounced. And there's been many a days I'm in an emergency room in any facility that we have that half of the emergency room, is with behavioral health patients. So when you think about that, we both have put and made a lot of investments in trying to solve the problem, both from an inpatient perspective and an outpatient perspective. We've hired physicians, we've opened outpatient clinics. I'm going to challenge us, and I know, of course, Gene's just a few days off.
This is day number 10.
He's day number 10. Day number 10. But part of what I think is just an idea that I think we need to think through is how do we, as competitors, come together? And I'm just going to throw some ideas out there on even back office capabilities. Whether it's our IT infrastructures, it's our revenue cycle. I'm just throwing a few out. I think there's hundreds of millions of dollars that could be saved and then redirected to the unmet healthcare needs of our communities, like behavioral health, like our drug abuse, and all the things that are out there, teenage pregnancies. It's that kind of thought that's going to change the game. And the first community that can figure it out, I think, is going to figure out things like behavioral health without waiting for a federal or a state and local answer. So my point is, I think that's an opportunity for us right here in Charlotte to be leaders in that.
Yeah, and I would agree. There's I love the term co-opetition, that old game theory term co-opetition, where people will compete, but you can collaborate around community health needs. And I think there's some opportunities to look at that as we go forward. I think North Carolina is number 34 in terms of health statistics in the country. It should be better. We're better than that. And so how do we coalesce and work together to actually be, as you said before, top decile in the country in terms of health status?
So I see the ladies coming up on the side, so that must mean we're almost out of time. But I do want to ask one last question to both of you, and it has 3 parts. So you two lead very, very large healthcare systems in the state. And I'd love to hear from both of you, one, what keeps you awake at night? 2, what you're most excited about in terms of this healthcare reform, what gives you hope, and 3, tell us something about you personally that we might not know.
Carl, you start.
That's great.
Give me a chance to think about it.
Yeah, no, I love it. I'll start with what keeps me up at night. I'll tell you what, so there's a lot of things that you could select from, you know, whether it's different things that are going on in healthcare, but that's not the thing that really keeps me up. You know, what I just described about this cooperation among systems across our markets, I really believe there's a lot of solutions that we've got to figure out together, and we've got to stop going in our silos and investing in our own approaches. That's probably keeps me up more, because I see the resources that we could reapply in the community that could address needs that today aren't being addressed. So that's the thing that keeps me up. The future, I don't know if you can tell, but obviously Gene and I are excited about the future of healthcare. I go into some meetings and I see a lot of CEOs, they're hanging their head, but I'll tell you what I'm really excited about. When I look and work with our physicians and our nurses and our providers, and I'm seeing how they're transforming healthcare at the bedside or in their clinics and at their locations to do just what I described about opening up access, making healthcare more affordable and convenient for people, and giving people a real authentic, personalized experience. I mean, so when I see that, that's what gets me excited about. The one thing you might wonder, well, why am I so excited? Because here's the thing personally about me you might not know. And it's something that I've dealt with. So at 18 months old, I was diagnosed as a type 1 diabetic. And I've lived with it for many, many years, have never had any complications. But I can't tell you how many shots, finger sticks, pumps, different things that I've dealt with in my life, and how the technology has evolved. But what I will tell you is when I walk the halls, you know, all of us eventually are going to need health care. And I see myself in the eyes of patients. And so what I want to make sure that we do is that we create that remarkable experience for them, because that's really what I focus on and what I'm excited about.
Thank you. I think what keeps me up at night, if you still look around the country, whether it's some inner cities or whether it's some rural areas, there is really a lot of socio-economic determinants of health that are really pervasive and generational. And so I think we owe it to the country as healthcare providers working with the collaboratives to really address that. And I'm not sure I think we're doing that very unevenly through the country. So I think that's really what keeps me up at night, and especially as we look at Carolinas, we have cities we serve and rural areas we serve, and how do we create that in a meaningful way? You know, we're all in healthcare, we're not making widgets. So at the end of the day, we want to evaluate ourselves by how well we did by our community. And so I think there's a lot of opportunities in that. What I'm excited about, if you don't like change, then you should choose a different industry. And I enjoy change. I shared with the leadership team, used this example a couple of times, just because it's a great marker for me. If you look at medical care knowledge in the world, from 1950 to 2000, all the medical knowledge in the world doubled, right? So, but if you look at 2020 and beyond, some predict that every 73 days, everything everybody knows in the world about medical science will double. So think about that. So we as healthcare providers really are going to have to adapt to that, and it's exciting. Also, there's going to be a lot of disruption. But so I'm excited to be in. Hopefully, God willing, I have a good runway in my career, and helping to shape that is something that I got into this profession for. In terms of personal, I guess I'm out because the team released a video of me, and so I acknowledge that I put myself through college playing guitar, and so I paid the bills, and so that's, you know, and I say that and I shared that because I think healthcare it can be a tough business, and I think it's important for people to come into this in healthcare and in their workspace being whole people. So some people are artists, some people play guitar, some people go fly fishing, whatever it is. I think that's important because this is about serving the whole persons that we serve for patients, and we need to bring our wholeness as well to that.
Okay, so I hope I speak for everybody in the room, but I feel like we're in good hands with these two guys leading our healthcare systems. So thank you for that.